The Texas system of care sought to build buy-in from leaders across Texas by having a state oversight committee and engaging family members, youth, state agency leaders, local community members, as well as other nonprofit organizations and stakeholders to come together and fill the gaps that they identified in their communities. The Child and Youth Behavioral Health Subcommittee is the oversight committee for the Texas system of care. It includes members from the state agencies as well as family members and youth. So state agencies including mental health, juvenile justice, child welfare, they are all represented. And also we have local community systems of care represented as well. System of care leaders from local communities also participate, and they are able to provide information about the gaps that they are experiencing in their communities and also about the strengths that they see as they implement the system of care approach. Those strengths can be shared across systems and implemented in those other systems, and other agencies can fill the gaps that another agency is reporting. And then altogether the strengths are shared and all of the gaps are filled in a collaborative manner. In the 85th Texas Legislature in 2017, the Texas Legislature reinstated the Texas System of Care framework in Senate Bill 1021. In this bill, the responsibility for the Texas System of Care framework and its implementation rests with the Texas Health and Human Services Commission, but HHSC must partner with the System of Care partner agencies for implementation. And also, the Texas System of Care must include stakeholders, including family members and youth, to help guide the development and implementation of the system of care statewide. At the System of Care Leadership Academy, the family members and the executive management members were able to level the playing field among themselves as they learned that they all use their personal stories in their daily lives and in their jobs. For family members, this is something that they do on a daily basis to help the families and youth that they work with. But for executive management, they also do this, but it is something that is not regularly acknowledged. But it was acknowledged at the Leadership Academy, and this brought together the family members and the executive management members as they learned that they use the same techniques to help our families and youth. One of the most important skills taught at the Texas System of Care Leadership Academy was about values and conflict. Sometimes values held by different people may conflict with each other, but this conflict may actually be productive and beneficial toward accomplishing the shared goals that leaders hold. As leaders acknowledge their shared goals, they can decide to move forward past their conflicts and implement the strategies that will help them to accomplish their shared goals. For Children's Mental Health Awareness Day, we have had representatives from the Texas Legislature take part in this event and share inspiring messages with the public from the Capitol steps. And we've also then walked from the Capitol over to nearby parks where we hosted activities for children and provided literature and resources for mental health awareness.